Thanks for the opportunity to be here and to present our WhatsApp-based microlearning for HIV training and its effect on patient care. So I think we all know that HIV treatment changes rapidly, as do the guidelines, so ongoing training of healthcare workers is vital. Traditionally in South Africa, this has been done face-to-face or in long-form online sessions, and there are many challenges to this in South Africa and other LMICs, including distance, time, infrastructural issues, and lack of human and financial resources. So we needed some innovative thinking. With 100% cell phone penetration in South Africa and 94% of adults using WhatsApp, that was the ideal platform. We know that time is precious, so we used microlearning, which is bite-sized bits of information sent via technology, and we designed online live WhatsApp group sessions. At lunchtime, 10 to 15 minutes at most, 1 to 2 learning points from the national guidelines, presented as a case, a couple of questions to encourage interaction, and then the answers in voice and text note. We designed a pragmatic mixed methods parallel group cluster randomized trial, which was run at 50 predominantly rural clinics in the Eastern Cape, with just over 500 participants divided into intervention and control groups. We measured uptake and participation, usability, and then changes in knowledge and patient care using online surveys, analysis of the WhatsApp interactions, focus groups, and then retrospective folder reviews. The retrospective folder reviews we did 48 weeks before the training compared to 48 weeks after the training, looking at learning points that were measurable. And we found a statistically significant improvement in patient care of 21% using a difference in difference analysis because our baseline means were quite different. So these results, in combination with our previously reported results of good uptake and participation, statistically significant improvements in knowledge, and high acceptability. 98% of our participants said that they would take part in this kind of training if we did it weekly throughout the year, brought us to the conclusion that WhatsApp-based HIV training for healthcare workers is effective, acceptable, and feasible. Thank you.